anything from 10, it's an enlargement. You need to do something about it. Okay. On a normal day, the prostate organ ought to measure between 1.0 to 1.5 nanogram per milliliter. So we have said that the prostate organ is directly responsible for the production of semen, while the testicles are responsible for the production of sperm. This prostate-specific antigen is the guy directly responsible for liquefying the semen. People who have an enlarged prostate may have trouble with starting to urinate or urinating freely. Herbs like stinging nettle helps to treat prostate enlargement. Today, we want to look into another topic in our quantum resonance magnetic analyzer device, and we will be focusing on the prostate data analysis. The prostate data analysis. All right. The prostate is an organ that we find in the male reproductive system. I want to first start by showing you an image and showing the location of the prostate before we go into detail, so that you can have an overview and a better understanding of what I'm about to talk about in the QRMA device. So this is the image of the male reproductive organ, and you can see the urethra, you can see the penis, you can see the testicles, you can see the seminal vessel, and you can see the colon, you can see the bladder, and you can see the prostate gland. You can see how they are interconnected. The seminal vesicle and then the what we call the vas deferens. Okay, this is where the sperm is produced, and it mixed in with the seminal vesicles, and it goes out through the penis, or through the urethra, from the prostate gland. So our interest is this region, the prostate gland. You can see that the bladder is sitting directly. Look at the okay. This is where the rectum is. You can see the connection. This is where the rectum is. This is the large intestine, and this is where the rectum is. See the connection here, right? All right. So we have the bladder, and we have it sitting directly on the prostate gland. So the issue with the prostate is that as we begin to age, from at this age now, let's say at age 40, from 40 lower, this prostate gland is usually the size of a walnut. By the time you start growing to aging to like age 60, it gets bigger. As it gets bigger, it grows to as big as a lemon, an average lemon, the shape of an average lemon, meaning that it's going to grow bigger than this. And as it's growing bigger than this, it means it's going to be pressing this bladder. It's going to be pressing it up. As it's pressing it up, it's thereby reducing the volume of the bladder. And that's why you see that people who have prostate enlargement issues, they begin to experience frequent urination, because just in a short while, because the bladder tank is no longer as voluminous as it used to be, the moment, just in a short while, it's filled up and you want to release more frequently than ever before, because the prostate gland has increased and has pressed against this bladder, thereby making them more uncomfortable and making them desirous to always go and urinate. So with this, it will give you a background picture of what I'm about to explain about the prostate organ. The first parameter that we have under the prostate data analysis is what we call the degree of prostatic hyperplasia. The degree of prostatic hyperplasia. Alright? The word hyperplasia is speaking of what we call enlargement. Enlargement. You see, there's a difference between when we are talking about the prostate organ, there's a difference between prostate enlargement, that is prostate hyperplasia, and what we call prostatitis, which we will be looking at also in one of the parameters.
In Keobik Healthcare Academy, we have pre-recorded tutorial videos of the quantum resonance magnetic analyzer device that has been uploaded on our website as an online masterclass course. Our QRMA device online masterclass course is currently the richest exhaustive training content that you will find on the internet today. It comprises of about 200 video clips for over 30 reports, explaining the anatomy and physiology of the various organs in the human body, with detailed diagrams to help our students to understand and own this knowledge with confidence to consult in their daily practice. Interpretation of test results, symptoms of abnormal organs, practical steps on how to detect common diseases with the QRMA device, recommended lifestyle, herbs and supplements are the main contents that are obtainable from our QRMA device training videos. It is a study at your pace training package, and every subscriber enjoys the good privilege of a lifetime coaching from Dr. Agnetica after subscribing. If you operate the NLS device, you will also need this training to enhance your knowledge of human anatomy and physiology. Keobik Healthcare Academy has so far built a credible record of training about 1,000 subscribers in 29 countries and still counting. You can be one of them today. What are you waiting for? Subscribe now.
You see, the difference between that is this. The difference actually is this. When we are talking about prostate hyperplasia, we are talking about the prostate organ becoming enlarged, bigger in size than what it originally is. But when it comes to the case of inflammation, we are talking about maybe the surface wall of the prostate organ, somewhere in the prostate wall, getting swollen, getting inflamed. Okay, so that's a different condition from enlargement. All right. Okay, so we have said that the prostate organ is the size of a walnut shape, and it does a particular unique function. It is directly responsible for the production of semen, while the testicles are responsible for the production of sperm. All right, and it is this prostatic fluid, that what we call the semen, that enables the movement, the swimming of sperm into the vagina for fertilization. All right, so that is why the prostate, the health of the prostate is very important. The prostate has two major functions I want us to look at. All right, the prostate secretes a milky fluid that nourishes the sperm that mixes with it before it goes out of the organ. All right, it is just like a little baby that we always, a newborn baby that we always depend on breast milk almost how many times within an hour. It is like depending on food. All right, this milky substance that the prostate secretes is very important for the sperm. All right, the mineral content of this milky substance we're talking about contains things like calcium, magnesium, potassium, zinc. All right, sodium, potassium, calcium, magnesium, zinc. All right, this is what the spermatozoa eats. This is what the spermatozoa depends on. It is nourished by it, and so it's the prostate organ that produces this. Another thing I want you to take home is this: that the prostate organ produces a particular molecular protein called the PSA. The PSA. The PSA means Prostate-Specific Antigen. Prostate-Specific Antigen. Alright? This guy that we are calling the PSA, this protein, this molecule that we are calling the PSA, is the guy directly responsible for liquefying the semen. Earlier on, when we discussed on semen analysis, sperm and semen analysis, we said that the semen, the component of the semen is gelatinous in nature. It's like a gel that is expected to dissolve over time. All right. It is the PSA. It is prostate-specific antigen that is responsible for the dissolving of this gelatinous material, this gelatinous mucus. All right. How does this happen? The word antigen, we are talking about the prostate-specific antigen. Now, it is specific on the positive direction because the word antigen may seem to connote something negative, as if we are dealing with a pathogen and so on. You know, an antigen is any substance that produces an immune response against another substance. Okay, any substance that causes the body. An antigen is any substance that causes the body to produce an immune response against that substance. So in this case, here we have this gelatinous mucus, all right, that is carrying the sperm. And by the time it gets to where it's expected to get, after a particular period of time, we need this thick substance to be dissolved so that the sperm can have the freedom to swim out and get to its expected destination. All right. It is this place that there's an antigen, a prostate-specific antigen, chemical that is produced that helps to break down this gelatinous material so that the sperm can find liberty to swim out of this body, this substance, and get into the cervix. All right. So this prostate-specific antigen is used to also measure the health of the reproductive organ, the health of the male reproductive organ. All right, because sometimes we may be developing a condition that is harmful. All right, there are three common problems that are associated with the prostate organ. We have what we call the prostate enlargement. So basically, the degree of prostatic hyperplasia is trying to check for prostate enlargement. We're trying to check for prostate enlargement. Another problem that's associated with the prostate organ is prostatitis. We are going to look at it in one of these parameters. So I will not talk about that one now. Then the third one is prostate cancer. Prostate cancer. So prostate enlargement, prostatitis, prostate cancer. But this first parameter, degree of prostatic hyperplasia, is trying to check for what we call BPH, benign prostatic hyperplasia. We want to check whether the prostate organ is enlarged. Now, in the orthodox settings, there is a standard measurement of the normal size of the prostate organ. On a normal day, the prostate organ ought to measure between 1.0 to 1.5 nanogram per milliliter, ng per ml. 1.0 to 1.5 ng per ml. All right. But the way things have developed in our recent ages, the normal range now varies with age. So I'm going to be giving you a list of what ought to be the normal range of the prostate organ. Now, below 40, the normal range is supposed to be 1.0 to 1.5 ng per ml. All right. Now from age 40 to 50, the limit has been extended, let's say from 1.0 to 2.5 ng per ml. All right. Then from 50 to age 60, it has been extended to, that's normal rate has been extended to 2.5 to 3.5. 2.5 to 3.5. Then from age 60 to 70, the normal range is 3.5 to 4.5. 3.5 to 4.5 ng per ml. Then from age 70 to age 80, the normal range is 4.5 to 5.5. 4.5 to 5.5. So now a situation whereby you have these normal ranges and your PSA level is higher than the one commensurate to your age bracket, then you can presume that it's beginning to become a case of prostate enlargement. It's going to become a case of prostate enlargement. All right. And on a general note, when an abnormal result, that's a case of a case of prostate enlargement, we are looking at the range of 4.0 to 10.0. 4.0 to 10.0. Basically, anything above 10.0 is not good. Anything above 10.0 is not good. Let me put it this way, all right? Based on the different age bracket, 0 to 2.5 ng per ml is low and normal, is okay. Okay? But when you have 2.6 to 10 ng per ml, then it is slightly to moderately elevated. From 10.0 to 19.9 is moderately elevated. It is moderately elevated. Okay? From anything from 10, it's an enlargement. You need to do something about it. Okay? Then from 20 ml, 20 ng per ml and above is significantly elevated. All right. So things like this, when you begin to see an enlargement of the prostate, one of the first point of call is to ensure that it is not cancerous. We want to find out whether it is benign or it is malignant. All right. When we are talking about prostate cancer, what you observe here is that you will discover that cells in the prostate organ begin to grow uncontrollably. They begin to multiply uncontrollably, and thereby trying to form what we call tumors within the prostate organ. All right, and that is dangerous because it can lead to the death of the patient. And so we don't have to let it get to that level. That's why in the QRMA device, the degree of prostatic hyperplasia gives us the opportunity to check if there is an enlargement there. All right. So these are things that I want you to know about prostate enlargement or under the degree of prostatic hyperplasia. Now, one common thing that we find out in the orthodox setting is that the moment an enlargement is suspected, their next point of call is to run a biopsy. It is good in itself because you want to check whether it is cancerous. However, recent research is trying to prove that biopsy is dangerous because it tends to trigger the growth of cancer cells even if they were not existing. So any other alternative to biopsy is what I will personally want to recommend. Take for example, if you know the nonlinear system analyzer, you can figure out, you can discover, you can find out the PSA. There are parameters there that directly shows you your PSA level. because the PSA level is used to predict prostate enlargement and prostate cancer. Alright, so in the NLS device, you can directly figure out what is the PSA level. If it is higher than normal, then you know what to do. Alright, now when it comes to also detecting prostate cancer, you can also use the NLS device to detect directly whether the enlargement there is cancerous or not. And that is a better alternative than going for biopsy. Now let us look at the result analysis. Okay, now looking at the results we have here, the normal range for degree of prostatic hyperplasia is 1.023 to 3.230. 1.023 to 3.230. Okay, so now a situation whereby your result is on moderately abnormal low or severely abnormal low, it is generally not a concern. In fact, from low to normal is okay. We really do not want the prostate gland to be getting enlarged because of the implication. But if you have it on moderately abnormal high to severely abnormal high, then it is directly indicating that an enlargement is beginning to take place there. An enlargement is beginning to take place there. Okay. Now, what we need to take note about the prostate organ is that because of it is that fluid, the fluid that it produces, that is what enlarges, that is what makes the organ full. That is why ejaculation is very important. Scientists have recommended at least 3 times a week. Okay, when you do such exercise, all right, what happens is that it reduces the chances of experiencing prostatic hyperplasia. All right, so if the result is on moderately abnormal high or severely abnormal high, it can be indicating BPH, what we call benign prostate hyperplasia, in simple terms, prostate enlargement. Or it could also be indicating prostatitis, that is inflammation of the prostate, or it could be indicating prostate cancer. Okay. Now, there are certain symptoms that is common with people who are experiencing an enlargement. Okay, and here are the symptoms that I'm going to be listing out for you. People who have an enlarged prostate may have trouble with starting to urinate or urinating freely. Trouble starting to urinate or trouble urinating freely. They also have problems with urinating frequently, particularly at night. They have problems with urinating frequently, particularly at night. Then they also have the feeling that the bladder is not empty even after urinating. They always have the feeling that the bladder is not empty even after urinating. They also have the feeling of a sudden urge to urinate. They always often have the feeling of a sudden urge to urinate. Now, then another problem they suffer from is the problem of having to stop and start repeatedly while urinating. The problem of having to stop and start repeatedly while urinating. Then another problem that I also suffer from is having to strain to urinate. When they have to contract their nerves, they strain themselves to enable themselves to urinate. These are the kind of problems that people suffering from prostate enlargement battle with. Okay, now let me give you some recommended advice, lifestyle that could help nourish the prostate organ. Eat vegetables that are rich in beta-carotene, lutein, or vitamin C. Take carrots and sweet potatoes that are high in beta-carotene. Take tomatoes, kale, broccoli, because they are good sources of vitamin C. take zinc, take seafood, take pumpkin seeds and eggs because they enhance the reduction in the size of the enlarged prostate. Saturated fat found in animal products such as red meat, whole milk, and ice cream has the potential of aggravating the symptoms of an enlarged prostate. So if you are experiencing prostate enlargement, you need to avoid foods like this, okay? Because they tend to aggravate the symptoms of the prostate that I listed earlier on. Things like herbs like stinging nettle helps to treat prostate enlargement. That's prostate enlargement urinary symptoms, okay? And like I mentioned earlier on, having sex 3 times per week, research shows that ejaculation process helps the prostate organ, as in the seminal fluid contains carcinogenic substances, and ejaculation flushes it out. Did you get that? Those seminal fluid contains carcinogenic substance, chemical substances, and ejaculation flushes it out. All right, so that is why this exercise is very important. So that's what we have under the degree of prostatic hyperplasia.
In Keobik Healthcare Academy, we have pre-recorded tutorial videos of the quantum resonance magnetic analyzer device that has been uploaded on our website as an online masterclass course. Our QRMA device online masterclass course is currently the richest exhaustive training content that you will find on the internet today. It comprises of about 200 video clips for over 30 reports, explaining the anatomy and physiology of the various organs in the human body, with detailed diagrams to help our students to understand and own this knowledge with confidence to consult in their daily practice. Interpretation of test results, symptoms of abnormal organs, practical steps on how to detect common diseases with the QRMA device, recommended lifestyle, herbs and supplements are the main contents that are obtainable from our QRMA device training videos. It is a study at your pace training package, and every subscriber enjoys the good privilege of a lifetime coaching from Dr. Agnetica after subscribing. If you operate the NLS device, you will also need this training to enhance your knowledge of human anatomy and physiology. Keobik Healthcare Academy has so far built a credible record of training about 1,000 subscribers in 29 countries and still counting. You can be one of them today. What are you waiting for? Subscribe now.